Hello, good morning everyone. I am Ma'am Barbo, and as you all know, I have handled your anatomy and physiology class. Now I am in team teaching with Sir Erlich Abenis for your subject health assessment. So for now, I will just be giving you an overview of what health assessment is, how important health assessment is for us healthcare workers. And basically, ini nga health assessment, asya na niya iton application na kuntahan iyo na hibaruan han anatomy and physiology. Because for health assessment, we will also do a head-to-toe examination for your patients. The nursing process serves as the organizational framework for the practice of nursing. So it aton sinisiring nursing process, nagtitikang hiyahiton assessment. So the cycle goes with assessment and then diagnosis. Then you plan for your care after you diagnose ano ba, what's wrong with her, what is your patient's condition. Then you go to planning. So magpaplano ka na kung ano mo mga interventions or mga procedures na pwede ning buhatan ngadto in pasyente. So after planning, of course, imo i-implement or imo na bubuhaton, and then after you do it, di rin yung babayaan itong pasyente kay tapos ka naman. Signong tapos ka na mag-bed bath, tapos ka na mag-feeding, tapos ka na mag-injection or mag-introduce in medication. Tapos ka na. No. After that, you will also do evaluation. And with evaluation, there is this certain amount of assessment again. So talaga, katinikangan ito nursing process is assessment. So since you are at the level 1 of this course, health assessment is part of your foundation or basic learning of the nursing process. So actually, assessment laanay. Anong assessment? Nagaano ka bahit? Assessment. So, idihit assessment, kinahanglan, systemic ngahin, continuous. Throughout the nursing process, di ba, assessment, diagnosis, then planning, hasta nangangalikan hit evaluation. Kada step ito, hindi na, permit hiya may ada health assessment. Permit kahit nag-a-assess. Hitun imo pasyente. Baga, upod hiya, package hiya permit. Pagkagatunim hit im pasyente, automatic ka paroon nag-i-screening. Assessment is the systemic and continuous collection, organization, validation, and your documentation of data. Diri nga na mag-document ang imo mga gin-assess, it's good as nothing. So parang wala kang ginawa. In nursing, if you did not write it, it means it was not done at all. So bisan ginhimo nimhiya kay waray man nimhiya charting, master nga dit doktor nga waray nimhiya paghimuha. Okay, so the nurse gathers information to identify the health status of the patient, and assessments are made initially and continuously throughout patient care. So from the start until the end, even if the patient is already for discharge, you will still assess the patient if really the patient is okay na. The remaining phases of the nursing process depend on the validity and completeness of the initial data collection. So kung very good ka, excellent it imo health assessment, it imo mga nasunod na mga steps ito nursing process, more or less maupay liwat hiya. Kay maupay man ang imo katinikangan, maupay ang in baseline data nga aton sinisiring nga nag-assess ka ng pasyente hintuhay, waray nin hiya pag ura-uradaha ang imo kun habaga health assessment, nakagather ka hin mga ungod nga hin correct nga mga data. Salit iti mo diagnosis magiging appropriately what or magiging correctly what. Okay? Okay, so what is the purpose of assessment? First and foremost is to establish database. All the information about a client, nga tanan, bisan la ito niti ngaran, iti edad, assessment niti part of the assessment niti itong demographic profile. Then, we go to the nursing health history, and then of course, your physical examination after that. Ito itong physical examination, more or less, pero pareho gayt ka ng physician na assessment, but our data is used not necessarily for the physician's utilization, or dire nga gagamiton hiton doktor mismo, but basically for our own basis on how we as nurses are going to go about our care. Kaya may dataman lagi hapdaman mga interventions nga pwede kita lang magdesisyon. May dagihap mga interventions nga talaga physician initiated or kinahanglan hin doctor's order. Okay. So, another kind of assessment gihap ito mga laboratory exams, x-ray, urinalysis, CBC, mga diagnostic tests like ultrasound. Itong lugod hiya, basically asya hiya basis itong doktor para makadiagnose hira liwat hit correct na sakit itong pasyente. So the purpose of or assessment is part of each activity the nurse does for and with the patient. Because kaya ano for the patient, kay para itong hit pasyente, and more importantly with the patient. You do it with the patient because you need the patient's cooperation. Bisan lang itong pag-assess itong mata or pag-assess itong irong. So kinahanglan itong pasyente, you will give them instructions and tell them to cooperate with you so that you can collect or you can identify the right things you need to identify inside the nose. So, unit pasyente magsisiliring, diriga, waray ng data. So, that's why we say that assessment is part of each activity the nurse does for and with. So, upod nim ik pasyente. You need the patient's cooperation. So, kinahanglan ma-validate nim itong diagnosis through your assessment. Then, also, assessment provides basis for effective nursing care. Siyempre, kung tama anim assessment, asya anim assessment, kinulaw ka aniya mata, aniya sclera pula, or aniya sclera yellow, then you will be able to identify different kinds of illnesses that associate with that kind of symptom. Also, assessment helps in effective decision making, basis for accurate diagnosis. It promotes holistic nursing care. Holistic, sinisiring tanganing nga holistic, that's not just physical, but it includes emotional, spiritual, from head to toe, nga tanan nga parte hiton lawas si tao ina-assess ta. Kaya danay diri ila asya tiya problema. Pagkadto niya hospital na siya masultak tiyan. Pero may da pa nga niya ibala nga problema, may da pa nga niya sakit daman ha kasing-kasing, may da nga daman niya habol di halikod. So kung waray kahit pag-assess, waray kahit pagpakiana, itay mula iya mahibubuligan ang suulahan iya tiyan. Okay? Then also, assessment is done to provide effective and innovative nursing care. So from time to time, ina-assess nimo yung pasyente na nabalik ka nga to patient's room or to the ward where the patient is, and then try to evaluate your care or try to assess again, ano na ma'am, kumusta natin pag-abat, akaya di naman dadaman di dilugod haloyot ak masuol. So again, you will change your plan of care depending on the assessment data you have. Then assessment also helps us collect data for research and evaluation of nursing care. Siyempre, pag nag-evaluate ka, di man like nga kukulawan lang nga ni mit pasyente. Sa gin-i-assess nga ni mit hiya para ka maka-evaluate kung ang nga tanan nga imo gimbuhat is may adaha iya maupay nga nahibulig. More importantly, the interventions that you and the doctor are doing needs to be evaluated through assessing the patient again. nga ano ba masuol ba nga hain naman yan masuol. Kung masuol, pag-rate from 1 to 10. So 10 as the gisasuuli, 1 naman as the least nga masuol. Okay? Now let's go to the types of assessment. So there are 4 types of assessment. We call them initial assessment, focus assessment, time-lapse assessment, and emergency assessment. So for initial comprehensive assessment, it is also called as the admission assessment. So upon admission ito pagkatod pasyente iton emergency room, asya sinisirinta nga initial comprehensive assessment. Ideally so ayo kang paghuna-huna danay na hinanabulit ito hospital dara kay busy iton mga tao dili na nakakapag-perform good masyadohin initial comprehensive assessment itong nurse or itong doctor. So whatever the immediate claim of the patient is, asya ina-address itong doctor or nurse. So admission assessment or initial comprehensive assessment is performed when the client enters a healthcare facility from a healthcare agency. The purposes are to evaluate the client's health status, to identify functional health patterns that are problematic, and to provide an in-depth, comprehensive database which is crucial or critical for evaluating changes in the client's health status in subsequent assessment. So, ininihiya nga klase initial comprehensive assessment is kung nakamatauran na, haro-halaba talaga inihiya kung higing bubuhat at daha emergency room. So, kinahanglan ta pa, mahibaroan na nila functional health patterns para ma-identify ta kung hain nga system haira or ano nga area talaga haira ang may ada problema. Then we have problem-focused assessment. A problem-focused assessment collects data about a problem that has already been identified. So, for example, maaram na kita nga iyang sakit, cancer. So, iting mga i-assess na haiya ng mga bagay-bagay is related to the cancer condition of the patient. Okay, this type of assessment has a narrower scope and a shorter time frame than the initial assessment. In focus assessments, nurse determines whether the problem still exists and whether the status of the problem has changed or let's say nag-improve, nag-worsen, nasulbar ba hiya. This assessment also includes the appraisal of any new, overlooked, or misdiagnosed problems. In intensive care units, may perform focus assessment every few minutes. Kay critical man ito nit kabutang itong pasyente pag ito kita or yan to hira ICU. Then we have emergency assessment. Emergency assessment takes place in life-threatening situations naman, in which the preservation of life is the top priority. So, kung may na-aksidente, yung na-intawon niya pag-interview hit iya spiritual, hit iya, sir, sexually active ka ba? Mag-a-assist ka pa iya reproductive system. Wala man kung habag kalabti ang reproductive system. Kaya na-aksidente, ulo man anahirante. So, life and death man hiya nga experience kung ano imo importante or priority nga kinikita at that moment asya hiyat imi a-assess ng pagbubuhatan hin intervention. So time is of the essence. Rapid identification of an intervention for the client health problem at the moment is your priority. Often the client's difficulties involve airway, breathing, and circulatory problem. So, kung nagdudurugo na tiya dida, wara nagiginhawa, asya na tiya imo priority. Abrupt changes in self-concept or suicidal thoughts or roles or relationships, such as social conflict leading to violent acts, can also initiate an emergency. Emergency assessment focuses on few essential health patterns and is not comprehensive. Diri hiya comprehensive, diri hinim hiya ubuson. Kay waray hitim oras kay emergency man hiya nga klase nga assessment. Then we have time-lapsed assessment or ongoing assessment. Time-lapsed assessment or reassessment is another type of assessment that takes place after the initial assessment to evaluate any changes in the client's functional health. Nurse performs time-lapsed reassessment when substantial periods of time have elapsed between assessments, such as, or for example, if we do periodic output patient clinic visits, so nakadto kahit balay-balay, home health visits, and health and development screening. As well as the direct hospital, nakakapagbuhat gihap kita nga time-lapse assessment or ongoing assessment if the patient is spending more than let's say 24 to 48 hours, mauro iya di nga na-admit. So every time magbabalik nim nga daha iya, ina-assess nga how nim hiya, ina-assess nim hiya. So ongoing nga dahit iya paggawas. Okay, so what are the steps of assessment? Collection of data or pag-gather tahin data from our patient. May data duduha. So may data subjective ngahin, objective. Subjective nga ni, ano sinisiring, love is subjective. So miring love is subjective para lahain. So hindi makaka-describe it. Iakula. Pareho it pain. Pain is subjective. Masuul. Masuul ko hiya. Anim ko buta ak masuul. Masaring ka naman. Buti man lang at hikuan nga ni kinubot ko daman. Wara mahiya suli. Kaya ano? Kasi nga, pain is subjective. For me, maybe my pain rating for, let's say, my wound, may da ko samad. Itak pain rating. Magpareho ulit itsura itak samad. Magpareho ulit daman ang kahalarum. Pareho daman na nakahabol haat. Pero, pagpakian hihaak, anak pain rating 10 kay arakan maak. Anak classmate, niya pain rating 5 la. Kaya no, one mahiya, strong, sinisiring pa. It's just an example, pero asyat hiya itong subjective data. Depende hiyayak ng hitin pasyente. Kung ano ang ginyakan han imo pasyente. Asyat hiya subjective data. Okay. And an objective data naman, an objective data is our data gathered from our assessment or our judgment na as nurses or as healthcare workers. So for example, nag-data collection kahan iya hair or nag-assess kahan iya hair. Okay, Ma'am Barbo's hair is brown, it's wavy, it's kind of dry, it has, kung may koto, that is an objective data. Kay kinikita taman, na mahidi-describe taman. Pero itong mga bagay-bagay nga di rin pwede describe para hitin pasyente, hiya like makakayakan hiya naka-experience han ka masuol, hiya ik maaram kung kakan o pagtikang ansuol, hiya ik maaram kung hin o nagpahimasuol haiya. All of those are subjective data. Then we go to validation of data. So may the validation of data, organization of data, and then you record. So ano yung mga data? Ayaw hiya pag halo-haloa. So kung nag-assess kahan buhok, tirempuha it kanan buhok ubos nga pag-describe or pag-chart or pag-surat, pag-document. Diri nga, nag-assess kahan buhok, na linukso ka naman na tuhan reproductive system, linukso ka na naman kung ano niya relihiyon, diri pwede. Kinahanglan step by step na ito nga imo, pagpakian na itong pasyente. But you don't have to worry, we have a form for that. We have a step by step format of how we are going to go about our assessment. Another important thing is after you collect your data is you validate. So kinita ka baga, for example, kinita kay habol, hadide, hanin pasyente. Masiring ka, mamaya adi mahin imo habol. Oh, that is a kind of validation. Diri nga magsusurat ka na lang, may ni habol dida. Ni habol pula, may ada dugo, na siya nga ni. Waray ka pakianahan ng pasyente. Mamaya da manim may da ko kinikita ng habol didi. Ano niya na ano ithiya, kakano ithiya kahabol, masuol bahiya. Oh. Yun yung i-validate mo. Isinulat mo nga siya, nakita mo siya. Pero pag istoryahin yung pasyente nga, ma'am asya niya ng findings. O, O, mag-agree daw la kita nga siya hiya. Mamit mo buhok brown. Hakon pagkulahit yung buhok brown. Masin naman yung pasyente, brown itak buhok. Kasi danay, mag-iba iyo perception. Sinisirintan mga perception ni tao. Kada tao mag-iba-iba tira pagkulahit mga bagay-bagay. So sometimes, we need to ask our patients about it. Basically, validate the data. And then, once you're done validating, you organize your data, you write it in an organized manner, and then that's it. You're done with documentation. Okay, so for the collection of data, gathering of information about the client includes physical, psychological, emotion, sociocultural, ano ka ma'am? Filipino, ethnic group? Filipino ka ba? American? We also assess for spiritual factors that may affect client's health status. Also, the collection of data includes past health history of the client. So, may ba ati mo pasyente allergies, na-operahan na bahiya, ano mga operasyon na niya pinagdaanan, his or her chronic diseases, may ada po ngayon sakit mga kidney, nagka-cancer ako una. Ayan. And the use of folk healing methods. Kaya dahil man hikita, natuod maliwat kita itong mga alternative medicine. So, ako nga ni dahil kita nagpapaluon, papaaso-aso ba? Ano pa, ikat ibang natin itong mga dahon-dahon. So, yan. Ia-assess na dihap itong iya. Or ipapakian na tahit at may patients. And collection of data includes current, present problems of the client, including if they are feeling pain, nalilinot ba, nakakaturog bahira, ano't ira sleeping pattern, ano't ira religious practices, the medications that they are taking at the moment, or the treatment the client is receiving at the moment. So, ako yan kay may ako man cancer, agsub ako magpa-chemotherapy. That is a kind of treatment that the patient is presently taking. Okay, when performing an assessment, the nurse gathers subjective and objective data. Again, your subjective data are the verbal statements provided by the patient. Statements about nausea and description of pain and fatigue are examples of subjective data. Objective data, or your overt, anaton subjective is covert. Ito naman objective is overt. Sorry. So, your objective data are detectable by an observer. Hinot observer, hikita na. Ang mga nurses na. They are detectable by an observer or can be measured or tested against an accepted standard. They can be seen, heard, felt, or smelt, and they are obtained by observation or physical examination. For example, your discoloration of your skin. Yan. So we have several data collection methods. May data observing, may data interviewing, may data examining, or the performance of a physical examination. Okay, next is may data duduha nga klase ng assessment sequencing. Ano here? May data head to toe, may data naman body systems assessment. If we base our assessment on the body systems, you are well aware what are our body systems are, diba? So, from what? The integumentary system, the nervous system, musculoskeletal, nga tanan na ito, asya hiya, body systems. Asya hiya, imo iga-assess. Kung head to toe, is magtitikan ka talaga didi. So, you assess the hair, the head, the face, the neck, the shoulders, the chest, lungs, ngadto, tipa ilaron. Okay, so, for head to toe assessment, using the physical assessment that uses head to toe, syempre, nag-general survey kalaan. So, the general health status, vital signs and weight. So, hiyagin titimbang, kinukuha niyo yung BP, pulse rate, temperature, respiratory rate. So, mga tanan ito niya, ibabaroan niyo in this semester, especially with your fundamentals of nursing. Then, we observe the posture, assess gait and balance. Ano hiya? Gait and balance. ipaglakat itong pasyente, nakakalakat ba? Abangin ng iis-is, di ba? And balance, diri ba yan naghihikatutumba? Evaluate mobility, activities of daily living, nakakaparigo ba yan ng mag-isa? Nakakakain ba ng mag-isa? Ayan. Head, face, and neck. So, we evaluate cognition, level of consciousness, the orientation, maarang pabahin kung ano nga adlaw yan na, ano na nga oras yan na, the mood, bulik pahiya ha, and mood, language and memory, sensory function, test the vision, inspect and examine the ears, test the hearing, the cranial nerves, we inspect the lymph nodes, so dinhi ini usually pinag-feel in here ta dinhi. Inspect the neck veins, we inspect and palpate the breast, auscultate the lungs, pinamamatayan tayo itong baga, auscultate the heart to assess the kind of heartbeat the patient has and the heart rate. Then, we inspect the abdomen. Okay, we inspect, auscultate. Ano't auscultate? Auscultate nga, ninagamit ka na iton, stethoscope. Yan, pinamamatayan. Palpate is you use your palm or your fingers to put pressure on an area, a certain area on the patient's body. And then percuss the liver. Percussion is, it is done through tapping your middle finger through your middle finger of the other hand. So, ganyan siya. Yan. So, kung may dani yung, if you are percussing a patient's, let's say, usually that pinipercuss man is the chest or the lungs. And there are different sounds that you will be able to hear over the different areas of our body too. So, basta basically, tigang nila niyo is, you can either, maluya kasi kon index finger. So, anatan talaga ginagamit is your middle finger to the other middle finger. Put it like that. Oh. Here, in this area, and then you tap, pak, there. Okay, so later, when we see each other during return demo, I'll be able to teach you how to properly do inspection, palpation, auscultation, and percussion. Okay? We also assess for bowel elimination. So, nauro ba hiya kada adlaw, kada sanuhi nauro, anat consistency iya pupo, yellow ba, green ba, brown ba, black ba. Then, we have the urinary elimination. So, nakakaihi pa ba sakto? Waray ba niya masuul na inaabot pang naihi. Ayan. So, all of those are included in your head-to-toe approach. We also assess for the skin, hair, and nails. So, we evaluate the skin turgor by pinching like that. So, pag bumalik yan yung kinuubot, meaning the fluid content of your body is still normal. Okay? And we observe skin lesions. Ano skin lesions? Mga habol-habol, bukol-bukol, gas-gas, kung ano-ano nila, and assess wounds. We inspect the female and the male client for their genitalia. So, we really look at them. So, yan na pala, ay ganaman ka mo pag-experiment nga, ito yung mga inggis, hala daw kayo mag-assessment ako, pakulaw, wagi daw, lanay kami ito na. But, basically, we will be able to do that in one point in time of your life as being a student, in being a student nurse. So, especially if you're going to put catheters to your patient, yeah. So, that involves your genitals. Then, we inspect also the extremities. We palpate the arterial pulses. So, at mga pulso tangalit at mga paa, siki. Observe capillary refill. How do we do assessment of capillary refill? So, if this is your nail, you pinch it. So, once you pinch it, pag na-pinch mo siya, di ba nagwa-white hiya? Pag buliwinin, diretso na balikin to pinkish. White, sorry, blue, and then pinkish. So, you do it on your own, ba hindi lang kinikita kahit ang camera, syempre low resolution. We evaluate for edema. Ano't edema? Itong edema, pamamanas. Nakita kamo ito na may mga sakit ito kidney, usually tira siking, at mga kamot, nananambot. namamanas. So pag imo tiya pinindot, pag pindot ay nimit manas na pasyente, malugok na lang tiya dira itiya mabalik. Pag pindot nimo it normal, pag pindot nimo wala mabalik lahiya. Pero kung may nim edema, pag pindot nim itlugok ada lahiya dida bisan tinanggal na nima ning finger. Then assess joint mobility, measure strength, assess sensory function, assess circulation, movement, sensation, deep tendon reflexes, and we inspect the skin and nails of your extremities or your legs or your toes. For review of systems naman, may data general presentation of symptoms. So, we will assess kung itong pasyente may fever, chills, malay, pain, sleep patterns, and we ask for the sleep patterns of the patient and fatigability. We ask for the diet, so your appetite, ano mga karuyag kaunin ng diri, may ada ba niya mga diet restrictions, allergy ba hiyahit mga let's say, ano na magrasang mga pagkaon, mga pasayan, mga crab, yan. Or, we let the patient write their daily food intake. Then, just the same as the head-to-toe assessment, nag-a-assess gihap kitahan skin, hair, and nails, the musculoskeletal system, may da ba joint stiffness, may da ba pain, when there is movement, swelling, redness. Ayan. We also look and assess for the head and neck. We assess the eyes, ears, nose, the throat, and mouth. And for endocrine and genital reproductive system, we will assess for thyroid enlargements or tenderness, heat or cold intolerance. Basically, mag-ibalent ira ngaran, mag-ibalent ira process, pero, syempre, kasi laghap na tao, the whole body lang ang gina-assess. Okay, we assess for chest and lungs, the heart and blood vessels, the gastrointestinal, genitourinary, neurological, your psychiatric, and for pediatrics, there is also another story for that for pediatrics and geriatric assessment. Ano pediatric? Pediatric ang kanan bata. Geriatric nga ni kanan lagas. Okay, let's go to that assessment techniques. May data inspection, palpation, percussion, auscultation, and another method is the use of the different equipment na may data. Like for example, may ECG, so nakaka-assess gapin iton heart rate, iton heart, if there is an enlargement. We use ultrasound, 2D echo, MRI, X-rays, all of those. Okay, so let's go to the complete health history. Ano niya? Ano sulod niya? So we have the biographical data. What is this? Your biographical data consists of you ask for the patient's name, sex, gender. So gender is different, sex is different. The sex is your biological, composition of what your genitalia is basically. If we say about gender, it's the orientation, or it involves the psychological feeling and the mental orientation of the patient of who they actually really are. And then we have the reason for seeking care. So pag itong pasyente hain mo, mapakian na kaliwat, ano man mamitaton tuyo, ano itaton igpapacheck up, ano problema ta nga kinahanglan ta ma-address. Then you ask for the history of the present illness. So basically, kung ano ang ira igin sumathain for the reason of their going to the hospital, ang papakian ka, anuhan history ito. So mapakian ka, kakano ka pa mahit pag sinuuli. For example, kung stomach pain, kakano ka pa pag sinuuli ang imtiyan. Kakano pa iti ang problema hain pagtikang, hahain dapit. Piranim edad, pagtikang hit, ano man na mga medications na imong gintutong marhit, nakapagpa-check up ka na ba hiton. Yan. Then you also ask the patient for their past health history. So, una, ano aning mga health conditions? Nag-agi ka na bahin operasyon? Nanganak ka na ba? So, ito. Then we ask them about their accidents and injuries. So, That's self-explanatory. Pakiana ka kung mayada bahay mo sa diferensya. Na-aksidente ka ba una? So, may ada naman yung fracture, kung diin-diin. Then, we ask for hospitalizations and operations that I have mentioned it earlier already. Then, the family history. Ano niya? Family history. So, hinuban, kung ano iya sakit, akong sakit asthma. So, it iya family history. Hinuman na nim, diditim kanim nanay side, nihit kanim tatay side, hinuman it asthmatic. Ayan. Or hinut mga diabetic. Hinuman may the high blood. Ayan. Then, we follow through the review of systems and the functional assessment or the activities of daily living and the perception of health. Ano ba it kanan pasyente pagkalaw iya overall nga health. Kay may damhitaw nga nahimang masaul tiya pag-abat pero iya pag-ambur hindi ang kalugaringon healthy lagi happy. So, may data sinisiring nga mga model iton pag-assess. So, again, kanina, ang body systems model, also called as the medical model or review of systems, focuses on the client's major anatomic system. So, the major organs na mayada kita. The framework allows nurses to collect data about the past and present condition of each organ or body system to examine thoroughly all body systems for actual and potential problems. May dagap kita Gordon's functional health patterns. Iba naman ang hiya. With this, the client's strengths, talents, and functional health patterns are an integral part of the assessment data. An assessment of functional health focuses on client's normal function and his or her altered function or risk for altered function. So, ano't mga siludhin yung Gordon's functional health patterns? Bulig dida, number 1 is your health perception or health management pattern. Ano ba ang ginagawa mo, ma'am, sir, para ma-maintain ka iton aton kalusugan? Second is nutritional metabolic pattern. So, ano itiya diet, nag-exercise ba hiya, ano itiya hilig kaunon. Then we go to the elimination pattern. That's the third. Ano tayo may papakiana? Elimination pattern. Siyempre, hiunong hit, pagpupu, pagwiwi, o ano ba ito may ba niyang mga problema, hiunong hit. Fourth is activity and exercise pattern. So, in 1 week, how many times do you perform exercise? What are the activities you usually do? At home, ikaw ba itang nagluluto? Ikaw aktibo ka ba? Things like that. Then, fifth is we asked for the sleep-rest pattern. Ma'am, usually, pira ka oras itin katurog kada gabi. Ano ka nga oras usually na katurog? Or di ka ba nahinga turog? Ano matim ni bubuhat, hindi rin ka nahinga turog? May ada ba ng tinutumar o mga iniinom para ka mahinga turog? So, that's for sleep-rest pattern. We also have cognitive perceptual pattern. So, ano niya? Iya mentality naman. Hindi mo i-assess. So, nakapag-aral ba siya? Tugtog din na niya natangkos? Nakakaintindi ba hihiti mo instructions? Nasagbang ba hihiti mo mga pakiana? Tama ba niya na isasagbang hiti mga pakiana? Iya ba pagkulawit mga bagay-bagay? Tama. Kung purukanan, purukanan. Kung yellow nga color, yellow. Yan. Just an example of a cognitive perceptual pattern. Then we have self-perception pattern naman. Ano niya self-perception? Ano't pagkulawit kalugaringon. Ma'am, ano't aton pagkulaw manhit? Ano't mo pagkulaw? Hit mo kalugaringon niya na. Ako, masing pasyente. Malipayon God na klasihin pagkatawo. Mastering ako nga okay good siguro ako may kumantrabaho, mayada ko pamilya. Usually, asyikit at binabati na answer iton pasyente pag nagpapakian at hiunuhit. Self-perception. May daga naman na sagba nga self at pagkulot at kalugarin yun, buutan, mahusay. So, pulig naman hiya. We also have role relationship pattern. So ini mapakiana ka, ma'am, kumusta man it atong mga relasyon? Nga hit at pamilya, hit at mga sangkay, so hindi mga katrabaho. Ayan, anot enroll dito habalay, ma'am. Iya ko nanay so iya ko nagpupuriga, masagot ito. Sexuality and or reproductive pattern. Ini diri kay kinahanglan maawod at pagpakiana. Pero yung pagpakiana, diri liwat kinahanglan nga bastos. Masaring ka, ma'am, nakikipagjugjug ka pa, diri. Masaring ka, ma'am, hikita nga sir, aktibo pa kita. Labing-labing, mga sagad lahat ito, pahapyaw wala. Ay, pagsaring nga, ano man, ma'am, nakikipag-sex ka pa, ura-urada ka naman, di ba? But basically, that is your sexuality and reproductive pattern. This also involves how you view yourself or how the patient views herself or himself. If he actually considers himself as a male or a female, ito na mga bagay. Then we have coping stress tolerance pattern. Mapakiana ka, itong pasyente, kung i-stress kita, ma'am, may ada ta problema, ano't atin dimbubuhat, or ano't atin mga solusyon, kasagaran. Nag-iinom na laa, di nga ni, ako nag-iinam puon or nagkikistorya akit at mga sangkay, kinakastorya ko itang asawa. So that is a kind of a coping question or coping stress question, so that you will identify the coping stress tolerance pattern of your patient. Then last is the value belief pattern. Ma'am, ano't aton mga tuluuhan? Siya papakiana ng iting pasyente. Ano't at mga tuluuhan, ano't aton relihiyon, natuo ba kita hit Diyos, diri, kung ano. Siya hit value belief pattern. Okay, last is the one we call the Barthel Index. It consists of 10 items that measure a person's daily functioning, specifically activities of daily living and mobility. The items include feeding, moving from wheelchair to bed and return, grooming, transferring to and from a toilet, bathing, walking on level surface, going up and down stairs, dressing, continence of bowels, and bladder. So, may adata din parang score sheet. So, yada, feeding, bathing, grooming. So, i-scorean niya kung kailangan ba niya bulig para ayusin niya sarili, para pariguan niya sarili, para magliwan, ayan, para makaihi, kailangan ba niya bulig. So, basically, sheet hiya. Ito, Barthel Index. Okay, so tapos naman kita an overview, diretsyo na kita nga dihan, interviewing patients to obtain a health history. So, papaano ba kita makakapag-interview? Kaya di ba an aton collection of data para iton assessment na involve man ang subjective nga ang objective. So, madila na kita subjective. Pag-interview iton pasyente. There are two primary components of health assessment, the health history and the physical examination. So for health history, that is your subjective data. O, diba? Subjective data, tikang hiya nga information ng imo pasyente. For subjective data or the health history, this is the database used to create plan, prevent disease, resolve problems, and minimize limitations. Okay, so our interview is affected by numerous factors. So, ano't aton kinahanglan i-consider bago, during, and after kita mag-interview iton pasyente. Of course, first is your physical setting. Bang nag-i-interview pag idada mo itaw nga sigit labay-labay. Itong pasyente naman maaawod haim hit pag istorihit ka matuuran kay damo mat na agi, di ba? Second is the nurse's behavior. So, kung nag-interview ka itong imo pasyente, kulaw hiya ay tuay, pag eye contact ka iya, ngan, pag-introduce lang itim kalugarin, ngan, make the patient as comfortable as possible. Ayaw pagsisari nga, pagpakihan na unong hit kuan, sexuality and reproductive pattern, masing ano man ma'am, inin nga, aktibo pa ka mga heser, Mastering naman kuntaan yung pasyente. Tama iha na pa damang kamihit pagkukod. Ikaw naman nga nurse masikot, ay mama ko, iha na, wala hirap pagkukuan. Judgmental ka, di ba? So your behavior as a nurse is a very big factor for your patient to open up to you. Dako iya nga factor nga magiging komportable it pasyente pag sumathain it iya unod nga inaabat kun it imo behavior appropriate, professional, matatapuran kaniya. Diri nga kaguguti-guti niya nga tawa ka it iya giniyayakan. Okay, so your behavior should be what? Professional. Professional. So we also are affected by the type of questions. So the interview is affected by the type of questions you ask. So as much as possible, give the patient an open-ended kind of question that is non-judgmental. So, kung again, sexuality and reproductive pattern, masaring ka, ma'am, diri na ka mga hisar nagkukuan ano. Diretso pa na nag-judge nga diri na imbis nga mapakiana ka leading iti mo mga question. Okay, so from the type of question we asked, so kinahanglan ha open-ended, diri judgmental nga klaseng pakiana, malumanay ka pakiana. Another factor is how the questions are asked. So paano ba nim gindadara it interview? So kinahanglan ikaw kalma para tin pasyente kalma liwat. Ngan iti mo posture, iti mo klasihin panyakan, iti mo boses, diri dagke, diri damang gunti, sakto lang. Para smooth iton flow iton iyo interview. Diri nga tinutuyo-tuyo ni danay mait may adit mga healthcare workers na dara kay nagdadagmit or dara kay simpa may nira ibang nga trabahoon o let's say may pinagdadaanan nira mga sarcastic danay itong mga pakiana. Tapos kadiri pakakaintindi iton pasyente gini isgan. Diri kita iton magsusugad ha. Another factor is personality and behavior of patients. So kinahanglanin daman i-assess iton. So pagkita niyo hit pasyente, bago syempre makaka-feel ka man iton kung iton pasyente nga awaren or at the moment aringit, iya, or nahahadlok, may na yung mga nahahadlukan. So kinahanglan mag-build kahin rapport. Pag sinasiring nga rapport, you start building a relationship with it nga niya, masaring diretso ka magsangkay. Pero at a professional level, mahipa-aambit niyo nga ito yung pasyente nga, you can be comfortable with me as your nurse. Another is how patient is feeling at the time of interview. So basically, nadi-discuss na naman daman hiya. So kung sad hiya, depressed hiya, ayaw intawon it nga nakita ka na hiya nga masuol na or nakita ka na hiya nga depressed hiya, masaring mapakiana para pakiana ka pa. Masing ma'am, depressed ka. Kung hiyakot yung pasyente lalata kung tae ka, masaring nag-nurse ka pa, yung mga klaseng pakiana. So, pakiramdaman mo, yung pagkulaw yan yung pasyente, good mood ba hiya? Usually, may data naman sugod naman ang mga instinct na daan. Then, the nature of information being discussed or problem being confronted. So, kung medyo confidential itong hiya nga iyo pag-iistoryahan, nga may interview mo, nga iyo interview, o dapat dito gihab ka mo sa nga intimate nga lugar. Or, i-maintain lang ng permit, it professionality between you and the patient, and of course, your environment. So, diri ka na hiton pwede nga nag-i-interview ka, nagsisinilpunon ka naman. O nag-i-interview ka, sigit impulaw nga dihit ibang nga tao habang nag-iina ka na itong pasyente. So, hindi maganda yun. And kung sinisiring ang nature of information being discussed, for example, magpapakiana hiya haim kung tugtog na lahiya sanod. Masaring ma'am nga or nurse nga ano daw laatan. Pura pa kaintindihan sa rin ni doktor na sa rin hiya bangin 3 months na lakon. Maano ka man inasubadit, di ba? So klase itong klase nga information nga yung giniistoryahan nga is medyo critical. So kinahanglan mahibaro kahit hito ng pananagbang hit mga sulokit ng klase ng mga pag-iistorya. Okay, so for the physical setting, kinahanglan aton setting during the interview is private, quiet, comfortable, waray mga distractions, nalabi na kung mga sensitive issues aton pag-iistoryahan. So, privacy is essential for sensitive issues. Openness and honesty. Healthcare facilities are not always conducive to privacy. So, karo kadak nakikita niyo dito sa hospital may mga kurkurtina. So sinasara hiya para diri na mambulat-lat itong pasyente kinikita nit nga tanan. Physical comfort for patient and nurse. Try to minimize distractions and place a distance of 4 to 5 feet between yourself and the patient. Ayaw pag-interview nga na dungdung ka ng pasyente. Taging distansya itiyo tinuturukan kung habaga kung 5 feet or 4 feet away from each other. Then you do note-taking. Some use of history forms is unavoidable. So, what are the disadvantages pag nag-note-taking ka? Takay kita pa damang kaulangan tagad mag-note-taking. Kaya dani kita nahinga kalimut anong ginina ka ng pasyente. Dara kay damit at pasyente. So, usually may data, tickler, na aman nagutay lang ang notebook nga padidala, ada kita pagsusurat kita mga data. But, if we are note-taking, it breaks eye contact too often. Kaya ano, imbes nga makulaw ka tayong pasyente, kaya magsusurat ka man, surat ka naman. It shifts your attention away from the patient. It interrupts the narrative flow. It impedes your observation of non-verbal behavior. So, dara kayo nagsisinurat ka mo, wala ka nakitahan iya ng non-verbal behavior. For example, nan mahidhian iya luha, wala ka nakikita. Kaya nagsurat ka mo, sinirin ka mo, nagsurat ka. And it is threatening to patient during sensitive issues. So, nag-iistoryahayain mo yung unong sensitive issues, ikaw naman sige yung surat. Diba? Kung sensitive issues, siguro, more or less, memoryahan na lang niya ginyakan or intindihan na lang niya ginyakan para yung documentation. Ayaw na yung tao, sinurat yung toto. Nga, habang nag-iistoryahayain yung sensitive issues, sige naman din yung surat. Kaya very uncomfortable. Okay, we have 3 phases of the interview. We have introduction, discussion, and the summary. So for the introduction, you prepare the patient for what to expect. Masarin ka, good morning, ma'am. I am Nurse Ira Barbo. I am from Eastern Samar State University, and I am going to interview you today about the different functional health patterns you have, ma'am. That includes your ganito, ganyan, ganito, ganyan, ganito, ganyan. So that's how you do introduction. The discussion is your working phase. So during the discussion, facilitate, collect, and record health history and data. Keep the interview patient-centered. So let the patient share their concerns, beliefs, and values on their own or in their own words. And the nurse facilitates, collects, and records the data. And then we go to the summary. So kahuman yung interview, it's a kind of validation gap. Diba kanina nag-discuss kita yung validation of data. So pag sinamarize mo yan, masaning ka, mama natin interview asyan hiyan aton na pag-istoryahan. Ini. Okay, so that's our summary. So data collected is the foundation of personalized and effective healthcare. It allows clarification. So pag-istorya nim nga ito ng pasyente nga, asyan hiyan mama nat summary, asyan na natin istoryahan mas. Masay naman pasyente, ay ma'am diri ngayon asya nakaroyag signal. So nakakapag-clarify ito ng imong pasyente iya mga information nga iyagin sumathain. And the summary provides closure. So diri lang nga kauman niya pag ginakan masanay. Sige ma'am, okay na tapos na kita. Bye-bye. Kinikang ka na. Itong summary sa igin papahibaro ni mga yung pasyente nga ungod-ungod nga namati ka. Kaya adinganihin akon mga sinamarize ng mga points na natin ng istoryahan. Okay. For professional nursing behavior, the first impression starts with nurse's appearance. Okay, syempre, pakipagkilala tayo atang pasyente, kinahanglan asyik nit atang uniform, white dapat. Kaya mo, we represent cleanliness, orderliness, pureness, kinahanglan kalma. Ayan. So, kinahanglan maupay. Primero pa lang yung pagkita, baga masaring man pasyente nga, ay, baysay man yung ma'am ni sir, kamalinis. O sige, sigunta na lang, kung di ka mabaysay, aminado pa di ka mabaysay, malinis ka mangga, di ba? And interpersonal skills important to successful interview. Ano hiya? Active listening. So, you use active listening to show interest and understand the patient's point of view. You communicate acceptance and treat patient respectfully. Watch word usage and patient interpretations and avoid extreme non-verbal reaction. It's masasiring ka ito. Ay, ayaw manggat. Kaya romantic pasyente. So, pamati la dida. Active listening lang. Patient-related variables. So first is we consider patient age and physical, mental, and emotional status. Ideally, the patient will be alert and in no physical or emotional discomfort. If in distress, limit the number and nature of necessary questions. So kung nakita ka na nga, medyo uncomfortable nito ni mo patient, tapos auraw-uraw or medyo nadidepress na, puro unihan na lang awit ang pakian na. Oh, you can move to the other question or to another question. Comfort. And then comfort lang the patient for the moment. Ayaw naman siya, ayaw paguro. Hayaan mo siyang mag-express ng sarili niya muna. Tagihin oras, tagihin time na makapag-express laan na hiya. Okay, we go to the art of asking questions. The art of obtaining information and listening carefully is an essential competency of nurses. Asyonali if you want to go abroad, in aton exam, for example, IELTS or International English Language Test, may reading, speaking, writing, and listening. Di ka na ni Mara mag-listen, kaya siya pa naman itathit trabaho on permi. You listen to the doctor, you listen to the patient, you listen to everyone around you para kaigsarabot kung mag-aano ka. Ba? Questions should be clearly spoken and understood. So, ay na pag pinaligoy-ligoy ito yung mga pakiana, pero maintain respect pag nagpapakiana ka for your interview. Define words, kung may ada mga words dito yung interview or hiti mo questions na diri masyado na intindihan, itong pasyente, so i-describe laan na hiya or i-explain laan na hiya. Avoid using technical definitions and use slang only if necessary for certain conditions. Adapt questions consistent with patient level of understanding and knowledge. Encourage patients to be specific to clarify meanings. For example, hinhini, ma'am, kakano pa hiya nga sakit. Pero kada ka naman pasyente na saring maihan na gan hiya. Ano ito ibig sabihin na maihan na itiya, ma'am? Diba? Sige ma'am, mga pera katuig. Mga ano nga tuig pagtikang. So, iyo mo na trabaho, pagpiga, iya. Diri nga, pag siringan yung pasyente nga maihan, medyo maihan na ganhiya. Ay, nalada may sinura. Medyo maihan na po. Pag siringan nga, doktor, Nurse Barbo, kakano pa kuno ini nga ay abdominal pain, masin ka naman, Dok, nasa rin hiya, medyo maihan na. O, lalatakong kahit yung doktor. Kaya di ka nga ni Marco, kano pagtika. Ito't mga kinahanglan na sagbang is, pira na katuig, pira kabulan, kakano pagtikang, pira an iya idadhan pagtikang hit. Yan, 2 ka simana, o sa kaadlaw, 3 ka adlaw, ito. Pero kung nasa rin ka, madali pagadlaw, waray value. Maihan agad, waray value lagi ha. Ask one question at a time and wait for reply. Oh, yan. You wait for reply. Ha? pakianan, piritim kuan, pipiritim anak, asya man hinan siya. Pero naman ko, di pa nga natatangkos pag siringan na napulot, iya anak, masing ka na diretso. Mga ano may natuwid kabuhing yung mga anak, sunod-sunod main. Kada mo naman im anak, asya, anto na niya, gin-interrogate, di ba? Be attentive to patients' feelings that may indicate need for additional data. So, kung na-feel nim nga iya answer very vague or na-feel nim nga there's something wrong han iya gin answer, pwede ka iton mag-follow up questions. Pero talaga, maintain respect lang nga ha. Nga, suwabe lang ba nga klaseng pagpapakianan? Some areas of questioning are sensitive and sensitivity varies. So, we have to explain that you may have sensitive or personal questions. So, tika sensitibo na nga nito mga pakiana. Kasi ka, ma'am, ini nga sunod na pakiana and medyo sensitibo. Pero, ayaw la pag-alangin pag sumathaakon. Kaya ini nga impormasyon, confidential in hiya, katapos, makakabuligin hiya para ma-diagnose ka hintuhay, hit doctor, hit mga healthcare providers nga, mabulig hain mo. Ha? So, palihugalak ma'am hiton pag-answerhin, kamatuoran lang. So, dito, ha? Use technique referred to as permission giving. Ensure your patient knows that it is safe to discuss a certain uncomfortable topic. And seek clarification. Masiring ka, tell me more about you are thinking. So, sige ma'am, ano pa man kung taititimhit mahisisiring hito. Kung asya hindi ma'am itimugin po problema, hiti mo pag-amburang ano daw lait mga posible nga mga rason. Sa ka na klase, hit pa, dahil in interview. We also have to begin with open-ended questions that as I have told you earlier. Focus on questions about patient's health. Ayaw na po pinamakiahin mga personal na mga bagay-bagay na hindi naman related sa kanyang kondisyon o kaya naman hindi related sa kailangan mong ma-assess. You may need to refocus questions if patients are unable to focus on topic or takes excessive time. So kung nahirarayo na ito yung topic, imbis na dila ka muhit kuan, aniyula kunta topic, suulhan ulo, kahamanan hingan to kamuhan bakasyon na taburakay. Bubutungan itimit interview nga to nga. Sige ma'am, hi ma'am, balik ngayon kitahan aton kanina topic, iununghan, imusulhan ulo. Ano? Sa ganito. Close-ended questions yield more precise data. Give patient options for response. And directive questions lead patients to focus on one set of thoughts, most often used in reviewing systems and evaluating functional status. Okay, so we have here the techniques that enhance data collection. First is active listening. So, maaram mo lang kamiton. Facilitation or the use of verbal and non-verbal phrases to encourage patients to continue talking further. Then last is clarification. Clarification is used to gather more information. We also have a restatement. Restatement is repeating what patient says in different words to confirm interpretation. Reflection is repeating what patient said and encourages elaboration or more information. Then we have confrontation. Confrontation is used when inconsistencies are noted between patient report and nurse's observation. Use tone of voice to convey confusion or possible misunderstanding. For example, say nilang gini-interview nga babae na an iya anak na napulo. Puro nila naman nakapagyakan hiya nga wawalola. So kinahanglan itnim hiya i-confront nga, ma'am kanina an imo haakon na hisumat na napulo imo anak. Yan na naman nasa rin kawawalo na la. Paki klaro la ako hiton ma'am dida dapit.